Okay, we are live. So, welcome everyone. We're thrilled to have you join us for today's webinar Best Practices for Cybersecurity Risk Management under Medical Devices Regulation MDR, hosted by TÜV SÜD Academy. A little introduction to TÜV SÜD Academy. We are a leading global provider of professional training and development. Our mission is to equip individuals and organizations with the knowledge and expertise needed to excel in their industries. Whether it's healthcare, hospitality, workplace safety, management systems, technical skills, or high-level executive programmings, our training programs are designed to support you and your growth and success. My name is Heather Charlson, and I serve as the academic advisor for the healthcare and hospitality industry. I'm honored to welcome you and introduce our distinguished speaker today, Samesh Rasal. Samesh brings over 9 years of experience in cybersecurity, having held various key roles in multinational corporations across industries including medical and healthcare, banking, manufacturing, software, telecommunications, and e-commerce. His credentials speak for themselves. He holds certifications such as EC Council Security Analyst, Certified Hacking Forensics Investigator, Certified Threat Intelligence Analyst, Certified Ethical Hacker, and OffSec Wireless Professional, among others. Additionally, he has a formal education in computer engineering. At TÜV SÜD, Samesh leads security initiatives, overseeing everything from training and concept evaluations to security testing and awareness programs. He has also presented his research at numerous industry conferences, including Open Security and medical conferences, making him a trusted expert in the field. Before we begin, a quick reminder. We'd love to hear from you. Your feedback is invaluable, and we encourage you to take a moment to complete our survey. Your insights help us continue to deliver relevant and impactful webinars for you and your teams. Also, please feel free to drop any questions in our Q&A panel. We'll make sure to address these all at the end of the presentation. Thank you for being here, and with that said, let's begin. Samesh?
Thank you, Heather. And first of all, welcome all of you. Good morning, good evening, good afternoon, wherever you are. And today we will be discussing one of the important aspects of the medical device industry is the medical device cybersecurity. And we have cybersecurity various standards which we are going to see in a couple of moments. But basically, we will try to understand in today's webinar what at least we should do to make our device secure and not worrying more about just to get the compliance check on the particular device. So I would like to welcome you all once again. So let's quickly first understand what today's security landscape is. So we usually start with the security risk management. Most of you already have done it for the safety according to 14971, 13485, and all those standards you might have read about it. But security risk management is additional to safety. Okay, so in this particular way, we can try to do the things in a very systematic approach from starting from the development phase to the testing phase, various roles we are going to obviously discuss in the couple of slides what exactly the step-by-step process or approach can be. Additionally, if we read all of these standards, basically talks about the intended use of the environment as well. That means what and where your device exactly going to sit in the hospital environment. So for that perspective, we need to be very cautious with our security architecture, not only for the device, but considering the intended use of environment. Cybersecurity testing, you cannot deny right now the situation, looking at situation attacks like ransomwares, couple of virus attack, hacking of the system, making device go unresponsive during the surgeries. To protect this up to certain extent, we will be obviously needing the cybersecurity testing, where we actually look for the vulnerability scanning, penetration testing, first testing, and robustness testing around the devices. Then obviously labeling is very important aspects of the security. And the finally is cybersecurity management plan. So cybersecurity management plan is basically the plan which we need to present at the time of submissions to all of these devices, to any notified body, or for that matter FDA, how we are going to take care of our devices in future time once it is on the market. So how we are going to identify the bugs, what will be the frequency cycle, when we are going to provide the security updates, when we are going to inform the end user, how we are going to protect attacks, how we are going to notify the regulatory bodies about the incidences. All those things we need to do in cybersecurity management plan. Please note that cybersecurity risk management plan is something which we do pre-market. That means our device is yet to come on the market. And cybersecurity management plan, which is the post-market surveillance plan, we need to get ready at the time of submission itself, and we need to follow that very strictly during our post-market surveillance phase. So now let's first quickly try to understand what is cybersecurity. Okay. Now most of you already uh, are working in and out with the cybersecurity, or more of general cybersecurity, where we are testing our perimeters, networks, and we have antivirus installed in our system. We have endpoint detections and all those systems in place. But is this really sufficient to protect against medical device? Now here we need to understand one particular thing. All the typical and the legacy method of cybersecurity, they provide protection of these medical device up to certain extent only. We need to make sure we have a product based assessment for that medical device to make sure the things are going in the right direction. We can protect our data, we can protect our people's life with this particular incidences. Now, just to give you quick understanding, I try to snip a definition from the standard, actually 81001-5-1. Now, for those who are planning to apply for Europe markets, so this is one of the very prominent standard, although it's not harmonized yet. Uh, Initially, it was got planned to harmonize in December 24, which is last year December, but yeah, due to some restriction, it got postponed, and now the timelines are a little bit ahead. But the good thing about this standard, this particular standard covers process-related requirement as well as product-related requirements for cybersecurity testing, which makes it pretty much unique. And also to support this particular standard, if you see FDA's recognized database, document recognized database, the standard particularly listed there. So it is one of the prominent and important standard which we usually consider during the security testing. Now, according to this standard, they try to put the definition in little bit a detailed way. Obviously, this slide, I will try to read the definition, but most of the remaining all the slides will be the discussions around it. So basically, cybersecurity means state where information and systems are protected from unauthorized activities such as access, use, disclosure, disruption, modification, or destruction to a degree that is related to the risk of security violation, confidentiality, integrity, and availability are maintained at acceptable level throughout the life cycle. So I try to divide this definition in three main parameters. Okay. So first thing, we need to protect our device against all the unauthorized activities like access, use, disclosure, disruption, and sometime modification also. On the parameters like confidentiality, integrity, and availability. And the last important point, we need to do this three throughout the life cycle. It's not only like we are ready with the pre-market testing, we have all the VAPT done, and then we submitted report to FDA, European Union, wherever. And once that is accepted, we are keeping security on hold. That is not possibility anymore. Okay. Now let's understand why these things comes into existence first. So hospital have these kind of requirements from very long back, but to make it more effective and easy to access, we have to try to balance both the things, hospital as well as manufacturers, and that's where this things started happening specifically. So now in the hospital side, although we have HIPAA compliance, still we have certain set of testings as manufacturing end as well. Okay. Now, obviously, I'm not the first person who is telling you about the cybersecurity. You might have read all the uh, documents, you are reading all through the news, and everyone is pretty much aware nowadays due to the attacks happening. But medical device is not something which we started using couple of years back, right? We are using medical device at least for decade or decade and a half. And if I say 2 decades also for some of the device, it's not wrong. Okay. But if we see suddenly these requirements started coming from 2015, 2016, 2017, and all those time frame. So what changed actually? We were using the medical devices in the 2001 2 as well, and now we are using in 2025 as well. But according to me, this change is the reason why we have this particular topic getting discussed and very hot and buzz in the market right now. So around 15 or 20 years back, the hospital used to look like this, where you have, if you want to operate any device, you first need to go physically towards that device, you need to punch in those commands, and then you need to get the output, maybe sometime in printed form, and then x-rays and all those things, and then you need to bring that report to the treating physician. He will look into it, and then again, if you want to go rescanning, he needs to go back and do all the things. However, in last couple of years, we have tremendously grown, and it is one of the biggest development in humankind, where we have now all the interconnected devices, where we can control the devices using various network aspects like internet, Bluetooth, Wi-Fi, sometimes Zigbee communications. In addition to that, we increase the digital storage of the data. We have thumb drives, we have cloud storage, and all those things. So now this is very good invention in terms of knowledge, in terms of help to the humankind, because now anyone can get treated very easily if physician is not physically available also. Even we have now a robotic arm surgeries. In couple of months back, there was a uh, experiment where people perform the surgery around 50 kilometers away from the hospital, and that was very well executed. Obviously, these things catch our attention and also attackers attention. Now this particular connectivity and all the interfaces of this application bring its own challenges. Previously, only way to get the data was physical. You need to physically bridge into the hospital. Then also, if you're lucky, they are storing data and digital copies, or the CD-ROMs, then only you can steal it, else it was only paper where you can get it. But nowadays, you can get these data sitting thousands of miles ahead. And that's where we started looking for cybersecurity in the medical devices. To quickly list down what can be the possible reasons why we are looking into the medical device security. So the first is obviously the personal health information or protected health information, where we have all the information related to a person is stored. Then we have obviously information about drugs and sicknesses, what all drugs prescribed, information about the concentration of radiation, percentage per drug intake, offset values, and all those things. So this is about the medical information. We also have personal identifiable informations like birth details, bank accounts, addresses, social security numbers, and all those also recorded in these devices. Sometimes it is for insurance purpose, sometimes just to make sure that your age fall for that particular surgery valid. All those informations we provide. Also, not only about the information, but it also controls the actual infrastructure. uh, Means attacker can pretty much run the command which can go and make device going crazy during the surgery, during any particular operation. Things can go for the toss. And considering all these things, it became a gold mine for attacker to steal all the information from here, or at least to operate the device from here. And the last thing, obviously, the compliance, which is the reason why we are here. We are discussing about these things. Now, here is unfortunately currently what we see. Not everyone, but the trend shows that people usually do security testing for the compliance to start with, and then they are worried about GDPR, HIPAA fines, damage of reputation, loss of sales, and patient harm, and obviously the personal health information. Now, here, getting compliance to sell your product on the market is not a challenge. Okay, everyone accepts it. But this security should be done in such a way that you are enhancing the life of patient. He should be feel more secure in terms of whenever he is getting treating to your device, he should be pretty much comfortable to go and do it. And the one way to show it is obviously the compliance with particular set of standard. But the other way to show it, like you're doing a lot of activities around security awareness, and you know the things, how things are going, what exactly you're doing. You're not cutting the corners here and there just to get the compliance done. All those things. Now, the bigger challenge here after this becomes the who will be the owner of it, because every one of us can read the standard, every one of us have the risk managers in place, and the compliance guys pretty much putting their heart and soul to make sure that you are doing all the activities and very rightly. But in the end of the day, we need to figure it out, who is the owner for this activity. Okay. And if you visit a couple of set of people, if you discuss, if you try to understand their perspective, it's always a ping pong ball. Okay. You go to developers, they will say, okay, we are not, but risk manager is. You go to testers, they will say, no, developers are not doing good. So we keep dodging our responsibilities on each others. Okay. And unfortunately, that is one of the reason why we are not able to make the very secure products in the first place. And if we are very much active and attentive about the security from the starting stage itself, like from design phase of the software, it will be very easy during the life cycle of product to maintain the security. And considering that in context, the ownership of the security is with everyone. Okay. So why I am saying this? First of all, your product start with the requirements, obviously. So the guy needs to document the requirement correctly. And on the basis of requirements, we usually go and draw the design diagram for the product. Now, at this level, we need to make sure we are doing decent and thorough threat modeling. Okay. So now this becomes responsibility of the security architect at that time or the design diagrammer, depending on the position, what JD you have within your organization. But it start with this, and then we do the risk analysis there, risk, whatever the countermeasures we need to put, and then we give this input to developers. Now, developer responsibilities are to make sure this particular inputs are incorporated from the day one. They are not using any hard coded credentials. They are not using any components with known vulnerabilities. They are not taking shortcuts. They are not leaving dead codes or not using any malicious or vulnerable functions like malloc in C. Those are the responsibilities on developers as well. So once development is finished, you usually go into the testing phase where testers' responsibility is make sure that they are not cutting corner here and there and running the thorough test of the security testing. They are checking for business logics. They are making sure all the entry gates are checked for this particular application. And eventually in the end of the day, it comes to risk manager to decide what risk needs to be accepted and what needs to be fixed depending on the business decisions and the risk appetite we can have as a company. Unfortunately, in current scenario, most of the people are pinning it on the risk manager for everything. But it's not only the risk manager's jobs to make sure things goes into right direction. It's our everyone's responsibility. Now, once we understand it is everyone's responsibility, now the bigger question, how we are going to decide if my device requires cybersecurity testing or not. This is very interesting question. Now, why these questions arise? Okay, people who are from the development perspective always thinks their product are secure, safe and secure, and they don't need any kind of cybersecurity testing. Now, unfortunately, this is the understanding of developer only, okay? Because till time you don't test it, you will not have conformity done that whatever fixes or whatever techniques you have used are pretty much solid and no one is able to hack into it. Okay. Now, the simplest way to identify if your device requires cybersecurity testing or not, it's this flowchart. You can see very simple. Just a layman person can also understand how he or she can decide if device requires cybersecurity testing or not. Okay. So first, we'll start with this first question. Is my device is active medical device including software? Software can be anything. Software can be a web application to software which is installed on the board also. So all types of software covers here, okay, including software as a medical device also. So whenever I say this answers yes according to my product, I need to ask a second questions. Okay, so now I have a simple active medical device which includes software. The second question is this device connected to IT network? Please note that it's mentioned as IT network, not as an internet. Okay, so IT network consists of all the communication ways like internet, intranet, Bluetooth, RFID, Zigbee, maybe Wi-Fi, and all those kind of communication channels where usually people use data either to back up the data or show the reading in mobile application for easier access, or sometimes it's for the cloud backup of data analysis and all those things. So if my device connected to any part of the network, that means cybersecurity is applicable. You need to do the complete risk management for particular wherever it says applicable. Okay, now let's consider I don't have any particular device which is connected. I have standalone device. Okay, now then I need to ask me next question, which talks about its personal information. That means your personal identifiable information or personal health information stored on this device. So if I have one device which can be either connected or not connected, if it is connected, I have cybersecurity applicable. If it is not connected, then is that device storing the personal health information or personal identifiable information? If it says yes, then it's CS cybersecurity is applicable. If it says no, then we need to go and ask the additional question to us. Okay, it's not connected, it's not storing any information, but is unauthorized access to this device is possible, which can further lead to the patient uh, uh, patient harm or user harm. If that is the case, then cybersecurity is applicable. Okay, again, now there is one question also in the chat about the in the cybersecurity applicability flowchart, USB port considered IT network. So just to answer that question, you need to see the left side of the screen where we'll walk you through around it. But let's to just start from the top. Cybersecurity risk management is needed in case of any of these answers. Yes, it can connect. That means any kind of communication protocol. Now, if you have any kinds of ports like USB, Ethernet, RGA, CD, all type of physical ports, if you are using for data backup or updates or any kind of other activity, those ports also fall under the purview of the security testing. And all the wireless communication channels also fall under the security testing. Now, there is a lot of questions and always debate going on about the third party softwares or the off the shelf components. Now, if you read all these standards, it's not only FDA, EU, or for that matter, any other standard. It's predominantly mentioned whatever is going to packed within your device as a product, you need to take ownership all of these. So if you are getting develop your software from third party vendor also, then also you need to make sure you have tested it thoroughly at your end to make sure your product is safe and secure. And similarly goes with the off the shelf components where you are using simple libraries like jQueries or any, for that matter, any third party library which is available on the internet you're using. All those should be considered into your risk management file. And the last point we need to, very important point we need to mention here and keep in the mind, that we need to test a complete ecosystem, not only the partial part of it. Now, why I'm saying this? So, due to our nature of business, we get to see a lot of testing reports, we get to see a set of documents with us. And the prominent mistake we observe is like, let's consider there is simple blood glucose meter and mobile application connected through the Bluetooth. So most of the time customers only do the mobile application testing, or they will do the device testing, or they will do the Bluetooth testing, or maybe either of these pair in the pair. But if you see the attack surface, we have attacker have access from all three parts. He can come through the application, he can come through the Bluetooth, he can come through the mobile device as well. So in all these cases, it's basically you need to test, then only you will get confirmation if all of these things are safe and secure or not. Sorry. Now, what can be the base documentations we should refer, or we should at least consider to understand about cybersecurity in more details? Because we say we should do the threat modeling, we discuss about penetration testing, vulnerability scanning, off the shelf components, and third party applications and softwares. All these we discuss, but where I can read more in detail, obviously. So first and foremost thing for FDA is pre-market submission guidelines. Pre-market submission guidelines tells us about all the nitty-gritty requirement from the FDA. And now we have E-Star submission format, which many of you might have already saw it. It is very easy and interesting ones where you get simplified version of all the things. You just keep answering the questions. It will keep populating the new questions, and just you need to select the files, right files at right location, and with ease of access, all those things can be submitted and easily handled. Now, to go into deep dive into the things. Now, FDA's document says we should do, as a manufacturer, we should do the threat modeling. Okay. So few of you might be already aware what can be the different type of approaches like stride, ride, pasta, and other agile type of threat modeling. But those who wants to go into detail and try to understand these particular technique and the way of doing it in the detail, FDA have very good supporting document, which is playbook for threat modeling of medical devices. It's very good guidance on the how you should do the threat modeling part. Now then we need to look into the principles of medical devices security for risk management to uh, see the holistic approach, what can be the uh, risk management types, at which level we should do what, how to reach from one level to another level. This particular documents will guide you very much in detail. And now for post market management and cybersecurity, this is one of the document which needs to be referred, which will give you the insights how you can do the post market surveillance of your device very effectively. Then we have the AMITIR 97, which talks about the post market risk management for medical device, another good documents for the uh, post market activities. Then how you should maintain off the shelf libraries. We have documents for the network medical device containing off the shelf OTS software. This is again very short and good diagram document. And then we have UL 2900-2-1, again recommended by FDA. Now, this is just a supportive document list for FDA. Now, if someone wants to go into the other market, like let's consider someone wants to go into European market, they need to refer some of the difference documents like IEC 81001-5-1, uh, 6601-4-5, MDCG guideline, MDR guideline, and all those documentation together. And the bigger challenge, it's not only the US and Europe, it's another few countries have their own different guidelines. Different Australia have their own, Russia, United States, Canada, Brazil, China have their own kind of things. Now, yeah, I can understand overwhelming for every manufacturer, but unfortunately it's necessary, because if we want to have the safer product, secure product, we need to put some efforts into the documentation. We need to put some efforts into doing the testing. And requirements wise, we can have the uh, a kind of middle ground where we can have the at least cover the most of the requirements we are going to see in the couple of slides after. But before that, I would like to quickly run you through the small survey. If you can, I can wait for 30 seconds. If you can please answer, that will be really helpful for us to understand your perspective. So you can click on it and then you'll be able to answer. I will give 30-second more and then okay. So there is one question in the chat. Will you share the presentation slide deck? I think I in the end of the presentation maybe Heather will able to give you more clear picture on that. But yes, thank you for that. And I have one more question for you, if you can quickly answer, and then we will go and go into the next question, next part of the webinar. Okay, till time everyone is answering, I have one interesting question here in the chat where I got asked about the guidelines specific to MDR. They were not listed in the previous slide. Ah, okay. So obviously, just to avoid the confusion of two documents in the same slide, we just try to hide that slide. But just to give you quick understanding, the document listed was more of towards the FDA, because if you see those documents, they are very closely written in collaboration with FDA. So similarly for European case where MDR is pretty much applicable, so we have a different set of documents like MDR, IEC 81001-5-1, 60601-4-5, and other set of documents like MDCG 2019-16, which is technically a guideline, 62443, which is the specific standard for the ICS security. All those standards can be surely can be referred while doing the submission for Europe, because obviously the basic requirements in most of the cases will be the similar, but it's always good to review it before submitting any particular document to the regulatory bodies. So now, thank you for answering both the surveys. Now let's quickly try to understand what is the current, at least bare minimum where we need to reach to make sure our documents or the product gets accepted on the market. Now, I try to create this on the US and Europe market. Uh, Maybe some other countries like Singapore or Brazil or maybe additional few countries may have some different requirements compared to this. But most of the US and European requirements are get used as a baseline for other part of the world. So it can be at least fruitful and valuable to understand this particular point. Now, in Europe, obviously we have the basic MDR right now, and then MGCG 2019-16. So in current state, whoever is applying for the Europe needs to at least fulfill MDCG-19-16 requirements, because those are going to get verified during the technical document assessments, that are TDAs, and audits by notified bodies. One level further, it's IC 81001-5-1 and FDA guidance. Okay. FDA guidance is obviously the, yeah, FDA pre-market submissions guidance. It's US primary FDA's requirements, and IEC 81001-5-1 again, which I mentioned, and the Europe, which was supposed to harmonize last year, but now it's little bit postponed due to the restriction. But this standard is still good because FDA have this particular document listed in their recognized database. Now, is it going to be sufficient to get the market approval? Unfortunately, it's not. Okay. The reason is FDA and IEC 81001-5-1 have very nice guidance. Okay. But this guidance are same for the all the set of devices, from the life sustaining devices to small devices. Okay. And from the FDA perspective, it's the correct way of writing it, because they cannot go and create particular document for the every other device. Then it will create unnecessary confusion among the industry. So what they say, they want you to do the certain set of things, and they want you to interpret certain set of things depending on the device severity you have. So that's why these documents says a manufacturer should have the process to do the penetration testing. And then they have given the list of references where you can refer how penetration testing needs to be done. But at that place, it's your responsibility to make sure you are doing sufficient amount of testing. You are doing additional checks on the part of the testing where you need to understand things in detail. You need to run the business logic related bugs. You need to check for the perimeter related bugs. You need to consider all the aspects like Bluetooth, Wi-Fi, USB, and thumb drive. This is specifically more related to your product, not as a only just because it said you should do the penetration testing doesn't mean you just run the automated scanner, do the VA, and then submit the report to the authorities. It's not what they expect from you. So they are expecting you're thoroughly thought about the test cases, you are doing business logic analysis, you are doing scans about it, and then also it's not up to pre-market, you have post-market surveillance plan as well. So if you are doing this much activity, then you will fall into the state of the art level where you will be able to get the market authorization in most of the cases. Okay, now I'm mentioning most of the cases because for everyone the cases will be different in X1 category. And please, please thought very detailed about this security, because people underestimates the attack surface, and then we get a lot of challenges while submitting these particular things. Now, is that guarantees 100% safe device? It's a cyber safe device. Unfortunately, no. Okay. Now here is we need to understand in very pragmatic way. We have one hand safety and we have one hand security. Now, in case of safety, up to certain degrees, you can pretty much define what exactly can go wrong with my device. Okay, you can know after running this many times this device get fails, or if I use this particular set of angles or this particular set of inputs, my device fails and patient can hurt. But in case of security, it's not that easy. You can consider component without any known vulnerability today, but after 6 months the same component will have hundreds of vulnerability. We saw many examples of this with the like log4j's. We see a different set of command executions with the older libraries which were getting used for 10 years, and now it got a research and we found the vulnerability. So it is not constant today. What you call as a secure device, maybe after 6 months they have a lot of vulnerabilities. In case of safety, it is very less chances to happen like this. And and particularly we need to consider this in very detailed way. We need to keep doing the things, and that's why we at TÜV SÜD we say security is not a state where you will reach. It's the process how we operate the process we need, and we do the retesting multiple times. We do and we go with the this process in the iterative fashions. Every change, small change we do, we again go and follow the process. Similarly, in case of security, we need to do the same. If we are changing any particular component, if we are adding any component into the system, we just need to quickly go and we need to make sure that we are running it through the threat modeling, we are running it through the code scanning, we are doing the sufficient adequate testing for it, and then we are putting it in the post market phase as well. And this cycle keeps running every now and then. Now there will be two set of users. One whose product is getting developed, they are following this kind of practices. Okay, every now and then they are doing security, every now and then they are doing threat modeling and all those things. But if your product is already completely developed and it's on the market, people usually tends to have very small time look for the testing, and that is where things goes wrong. Okay, so irrespective of your device is getting into the further actions, if your device is getting updated, your device is functionality wise getting updated, you still need to do the testing irrespective. Okay, so this is one of the key importance here to know this. Now every one of us understand these things. Okay, now what is the challenge, why we are not able to do it? Now currently, as this security topic is quite new compared to safety, and we try to weight on the scale of the safety only, and that's where it becomes a lot of mess. There multiple ends, multiple standards, set of requirements from the different countries for different specific reason. Currently we have very limited manpower available. Now why I say it's limited manpower, because the manpower we have right now are experts of security, and then we have experts of medical. Now to understand this particular thing in detail, we need someone who understands both of the things. He should know the medical, at the same time he should know the cyber security. Then only he will be able to judge the product in the right fashion. If you bring someone who is doing everything related to the let's consider banking, for him any application which can be accessed without username and password is challenge. Okay, but he will ask you to put username, password, multi-factor authentication and all those things. in the system, but you think your device is defibrillator. Now, if someone asks you to put the username and password on that, because anyone can go and use it, that is not the correct way of approaching medical devices for security. And that's where we need expert, which unfortunately we have very limited right now. Limited resources, ever changing resources right now, and limited choices, and then training requirements, accredited labs, and so on. There are many things which we go and we look for. So, considering these all things in mind, right now it's becoming little bit more difficult for the people to understand the basic requirements on the things. And in this particular webinar, we try to answer this, at least to just start with the talking about this documents, references, and all those things. So with that said, I would like to ask Heather to take it ahead from here. And if you have any question, feel free to put it in the chat so we can discuss in the Q&A section.
Okay, great. Thank you, Samesh. We truly appreciate your insight and expertise. Moving on. I just wanted to point out there are some courses coming up that might be of interest to you. We have the Best Practice Medical Device Regulation, MDR Cybersecurity Risk Management, Content of and Compliance with IEC 81001, and Introduction into Medical Device IVD Penetration Testing. All of these courses and all of our other great courses can be accessed through scanning this QR code. So feel free to go ahead and scan that to find out more information on dates, cost, and course content. And you can also feel free to reach out to me as well. Just another reminder here, we have another live webinar coming up for the EU MDR and AI Act, bringing AI-enabled devices to Europe. So again, scan the QR code to register and join us on May 8th at 2 p.m. Eastern. And then lastly, TÜV SÜD at a glance. So maybe many of you know or don't know, we have a dedicated team of global experts. We are the global leader in management system certification, validation, and verification audits. So if you have any interest or need in those services, feel free to reach out. It's really easy to transfer your ISO certifications to TÜV SÜD as well. And we have a great team that can help you in doing so. All right, so thank you again for joining. At this point in time, we'd like to open the floor for questions from our audience. So feel free to share your thoughts and inquiries, and we'll be happy to address them.
Okay, Heather, there is one more question. Are you able to provide further guidance on how document state of the art of the medical device? Yeah, we would be happy to share this information, but obviously this is very short time frame. It takes a little bit time to discuss, but yeah, this particular things can be discussed pretty much, and you got the email addresses here, so feel free to drop us a question there and we will be happy to take it and discuss that thing. Okay. And also
sorry, I was going to say, I think we have we do have some other questions as well. I believe they are for you. So the first question that I have here is from, and I apologize if I get your names wrong, but this question comes from Nadeem Omir Jin. and they're asking, in the cybersecurity, is the cybersecurity applicability flow chart, is in that flow chart, are the USB ports considered IT network?
Yeah, so sorry, Heather, on that, because that is already answered. So I will choose
Oh,
question from my end. Okay. Yes,
okay, perfect.
thank you. Another question is, are there any ongoing global harmonization efforts for the cybersecurity? Uh, See, it's a little bit difficult topic because the definition of the data privacy is a little bit different in the different part of the world. And considering that, although there should not be many standards for sure, but at least in coming future we will not have able to have one standard which will cover every part of the world, because both of the standard, irrespective of it's European or FDA, both of them are considered in considering the local requirements and other policies kept in the mind, and that's how it's developed. But again, it can be in future, but not right now. Maybe not in near 1 2 years. So I hope I able to answer that question. And is there any more question uh, about applicability of 81001-5-1 and AMI-SW 96. So basically, AMI-SW 96, it's more of related towards the software, and whereas 81001-5-1 covers the almost all the things like software as a medical device, as well as the software hardware based medical device. So compare the score. That's something which we need to check what is your exact question, and then maybe I will be able to answer that, because it's something pretty vague in terms of understanding. Can you compare the score and applicability for? Yeah, so that is something need to check. Heather, there is one more question. Can we be able to share this slide deck with the attendees?
That's a good question. Is that for you? I'm not
Uh,
sure. I
there is one
apologize.
question in the chat that if we
Okay.
can
Yeah.
share.
So yes. So we will be able to share the slide deck.
Yeah, thank you. That's 10. Yeah, I guess that's pretty much it, and we are well in time. So, Heather, over to you to wrap it up.
Okay, great. Thank you so much. So we hope everyone enjoyed the webinar and got a lot of useful information out of it. Samesh, I want to thank you so much for taking the time out of your busy schedule to be able to join us today and present. It was, to me, very valuable information, and I'm sure same for everybody else who has joined. If you have any questions, feel free to reach out directly to Samesh. His contact information is here as well. And regarding any of our trainings, upcoming trainings, or any questions you may have for that, you can feel free to reach out to me as well. And my email is there. So I guess that's it. Thank you all for joining, and we hope to see you in the next webinar.
Thank you.
Have a great day.
Everyone.
Thanks.